in the know live on WJZZ Cool TV. We are streaming live on Facebook, YouTube, Twitter, Twitch, and other top social media networks. Please like, follow, and subscribe. Thank you for watching WJZZ Cool TV, the coolest station in the world. I want to thank everybody for joining me today. I want to welcome everybody back for 2022. I am your host, Cassie. My co host, Kim, is still away recuperating, resting well at home. I hope that everybody's holiday season was wonderful and that everybody 2022 will be blessed with peace, prosperity, and good health. Over the break, I asked my audience to give me some topics for some upcoming shows, and I got a request from nurse Keisha Perry. Thanks for being with us today, Keisha.
Thank you. Thank you. Thank you for having me. It's an honor.
Thank you. And we are, for the next 2 weeks, we are going to be discussing women's health. Keisha thought that women's health would be a great topic, and I thought it would be as well. So, if you could just introduce yourself for us, introduce yourself to the audience, and tell us what you do, and you know, give us a little background on yourself.
Okay, so a little background. First of all, like I said, I thank you for allowing me to share with the community today. My name is Keisha Perry. I am a registered nurse. I have been a nurse for over 21 years. I work in the medical surgical arena of nursing. I'm a bedside nurse. I've worked in case management, home health care. I am also a state tested uh, nursing assistant instructor, I'm sorry, for the state of Ohio. I am currently pursuing a PhD degree at the College of Nursing at Wayne State University. I am the CEO of Infinite Effects, and basically it's a personal development business, and it empowers women through education and engagement. And I am so happy to be able to share, I think, a very important topic with the community today.
Wonderful, wonderful. Now, I noticed that you said you did you say you lived in Ohio? But I
Yes, I
know
do.
that,
Yes, I
okay.
do.
So you go to Wayne State in Michigan and Detroit?
Yes, I do. So I
Okay.
commute. I commute from the Toledo area, which is about a 45-minute drive. And I also work in the Ann Arbor area at one of the most well-known hospitals in the area.
Okay.
So I spend a lot of time on the road commuting.
Okay, wonderful, wonderful. So the topic that you brought to my attention, and I thought it was very good topic, and it needed some it needed some clarification in so many different areas when it comes to this subject. We talked about menopause.
Mhm.
So I thought that was a very good topic. I know sometimes people don't really want to talk about it, so that made it even more interesting to me as far as the subject matter went. And I just want to start off by asking you simply, what is, for people that just don't know the definition, what is menopause?
So, first of all, yes, that's excellent. Before we actually talk about menopause, I would just a second. I would like to. My computer is acting kind of funny. I would like to define menopause, and menopause is basically, we're going to break down the two words. Meno is menstruation. And then you have the pause, which is the absence of. So it's basically referring to the ending of your menstrual cycle. That's what the word menopause mean. For those that hear it, thrown around loosely, but never understood exactly what it consists of.
Okay.
So, menopause is a stage of womanhood that marks the end of fertility. So, you have various different stages of menopause, and it's three different stages.
Okay.
And you have the perimenopause or the premenopause. Both of them are synonymous, they're the same thing. And
Okay.
then you actually have the menopause. Then it goes into the postmenopause, which means after your period or your menstruation cycle has ended.
Okay.
So menopause is defined as a time when your period has stopped for over a year, and that's consistency. It's not that it stopped for a month and then it came back the next month or a month afterwards. It means that you have not had a menstrual cycle in a whole year. That is considered menopause.
Gotcha. Gotcha. Okay, so with that being said, once menopause, perimenopause, menopause, postmenopausal, once these stages begin, can you give us a little what should a person expect during the first stage?
Well, the first stage, we will talk. Actually, I want to kind of, if I can just give a little bit of anatomy physiology
Go ahead.
um, to the community to better understand how menopause occurs in the body. All right. And I hope we have some males that's, listening to this because this is going to be a big help, even though it doesn't affect you directly. It affects you indirectly. So then you'll understand the whole process and what to expect and why you see the different changes. You'll understand a little bit more.
Why your wife
So
is crazy, maybe.
right. So the ovaries are a pair of organs located in the uterus. The uterus is the little round shape that houses it's called the womb. That's where the baby basically lives during pregnancy.
Okay.
Okay, so on each side of the uterus, they're called ovaries, and they're about the size of almonds. Okay, they're almond shaped. And a woman, when she's born with a large amount of eggs that is housed inside of those ovaries. So each month, those ovaries will release eggs that can be fertilized. And the ovaries also secrete hormones, which is very important in the menopause process. The two hormones that you will find in those ovaries is the estrogen and progesterone, which
Okay.
are essential for the regulation of monthly menstrual cycles and for ovulation.
Okay.
So that's just the little anatomy physiology, so you'll know exactly how that all kind of ties in when I'm referring to certain words. So today, I guess what I wanted to do is give you a basic foundation of menopause. So it's not going to be in depth, but when we're done, you're going to understand the whole process a little bit more, which more education means that you're more empowered to speak up and you know what to look for. And that's the whole point of is basically to advocate for yourself. Okay.
Absolutely.
So with the perimenopause, it is a period of time leading into the menopause transition of a woman's final menstrual cycle or period. And this can be anywhere from a couple of years to 10 years.
Oh wow.
Okay.
Okay.
Exactly. So when we start looking at menopause and thinking it's menopause, it has actually started years before. But the
Okay.
thing about it is, like you say, it's not something that's discussed often. So a lot of the symptoms that we will experience in menopause, it's just like, oh, I don't know what that's about. That's just because I'm getting older, and we blame everything on getting older. But we really need to kind of take time and find out more about our body. So therefore, we know our body's going through a change. We can understand the whole process better.
Now,
So,
is there
um,
some sort of test that can let a person know that they're going through these stages? Is there a
Um, yes, it's called the FSH, which is the follicle stimulating hormone, and
okay?
they can do lab tests, and it will tell exactly how high or how low those levels are, and that's when they can say, "Oh yeah, you're in menopause. Oh yeah, your monthly cycle is done. You're done." So yes,
Okay.
it is. So, but the thing about it is, when you don't know what signs and symptoms to look for, this is a conversation that you probably wouldn't have too soon with your physician.
Yeah.
So,
Give us some of those signs and symptoms.
first of all, in the earlier stages, which I would say this can happen as early as 30 years
Oh,
old, 40 years old. And but the average age of menopause in the United States is 51 years old. So
okay.
some of those signs and symptoms would be basically, oh, I'm just for some reason I'm just so tired. I just don't have the energy that I normally have. I just want to sleep. And then you'll notice that sometimes, during the night, you're noticing that you're up back and forth to the bathroom a little bit more often. You're urinating more, which
Mhm.
is nothing that you think about because, after a while, we accept it as becoming the norm for us, even though we know this is something new for us. Also, you may have problems with your acne. If it was, you know, you never had problems with acne, you may start experiencing problems with acne. You may have dry eyes, some vision issues. Your breasts can become tender. Also, you can also have some heart palpitations, which they come and go pretty lightly. It's like, oh, I don't know what that was about.
Mhm.
And you go on. But these are things that happen. They're subtle changes. They're not something that's like bam in your face to where it's like, oh, something's wrong. So
Mhm.
eventually, you don't realize that your body is preparing to end the menstrual cycle
Okay.
and your stage of fertility. So, those are some of the things, but you'll have your nails may become brittle, your hair can become dry.
Hair
Um,
I know that hair loss is a big issue for women during this stage, and
exactly.
yeah, so I know I see a lot of different advertising, menopausal hair loss and things of that nature. So I know that the hair loss thing is a big issue, and also
Hmm.
the weight gain.
Hmm.
So is that because the estrogen or those hormones are no longer in doing what they're supposed to do?
Exactly. So when your ovaries are no longer producing the estrogen, estrogen keeps the body moist. You have mucous membranes, everything is nice and moist. You have the lubrication for your joints, you're able to move around, you don't feel stiff. But when the estrogen level decreases, then that decreases that lubrication in your body, even in the vagina. You may notice that you're not as moist and lubricated as you used to be, and that's because the estrogen is decreased. So the tissues are not receiving that moisture from the mucous membranes. So,
Wow.
yeah, and hair thinning, you have the issue with the hair thinning, the hair growth, but also you have an issue with more hair growth in areas that you don't want, like the lip, the chin, and all of that. So, yeah. Yeah,
Okay.
and those are things. What woman wants to talk? Hey, I have hair growing on my chin. It's like what?
Mhm.
So, but those are things that we do need to talk about. It's
Yeah.
normal. And once we realize that menopause is a part of life, we'll be a little bit more open to discuss it more.
Okay. So you talked about the natural process of menopause and the ages and how it'll the starting ages and things of that nature. Now, are
Mhm.
there other ways that menopause can occur? Um,
Oh yeah. Yeah, most definitely.
Tell us some of the
Yeah.
other ways that menopause can occur other than your estrogen, your hormone levels decreasing.
Okay. So some of the other ways that you can actually be triggered into menopause is surgical intervention. You may have a hysterectomy, and that may be because of many reasons. You may have the symptoms, all of these symptoms you're experiencing may be to the point that you can't. It changes your quality of life. In other words, I'm getting hot flashes. I can't sleep at night. Insomnia. I'm tired, I'm irritable because my estrogen levels are up and down. So when they're up and down, my mood follows. So it's like, ooh, so she's not crazy. No, guys, it's the estrogen, the lack of, or the ability to try to balance it out. So sometimes individuals may have what we call fibroids, and fibroids it's an issue that causes the woman to bleed constantly. So it disrupts her life. It disrupts her significant other's life, husbands. And so therefore these are things that the reason why I keep on pulling the guys in, because it's like, come on, Vicky, I want you to be educated as well. But
Yeah.
anyway, so a constant bleeding, after a while, it's like, some women try to wait until that menopause stage kick in, and
Uh-huh.
that will kind of decrease that flow of blood or take away the menstrual cycle altogether. But some is like, I really don't want to wait that long, because you never know when it's going to happen. Like I said, it can start at what, 2 to 10 years, and who's going to wait that long for constant bleeding? You don't know when you're going to start, because your menstrual cycles are not consistent. They're just whenever they decide to come. So with that, you may want to look into surgical intervention. And also, menopause can kick in at the age of 29, and that could be because you have some health illness that causes that. Say, for instance, breast cancer. When a woman have breast cancer, she may opt to have chemotherapy. And when she has chemotherapy, the chemotherapy may trigger the menopause. So when that menopause is triggered, immediately she starts having those symptoms, those hot flashes, those cold sweats at night, the inability to sleep, and the weight gain. And you mentioned something other earlier about the weight gain. And when the estrogen changes, then your body, the way it stores the fat in your body, changes. So you'll see a lot of women, their weight is more around the midriff area,
Okay.
so which is not good, because that increases the risk of heart disease.
Okay.
So those are some of the ways that menopause may be triggered, other than just the normal way, from surgical intervention, fibroids, or chemotherapy, cancer, different things, because cancer does different things to the body. It's not a normal process. So
Absolutely. So right now, I just want to open up the lines. If someone wants to call in and they have questions for Keisha Perry, we're talking female health, female health, menopause. And she is here today giving us some great information. I just want to tell you guys again, you're watching In the Know live on WJZZ Cool TV, streaming live on Facebook, YouTube, Twitter, Twitch, and other social media networks. Please like, follow, and subscribe. Thank you for watching WJZ Cool TV, the coolest station in the world. Okay, so um, we were discussing menopause, some of the effects that some of the signs and symptoms that occur during those stages. You mentioned the heart disease.
mhm.
So menopause can actually throw your body into other medical situations. So other than the heart disease, is there anything else medically that menopause will actually, other than the heart disease and the signs and symptoms, hair loss, weight gain, is there anything else that menopause will, send a woman to?
Well, yes. Another area that you should focus on is also uh, osteoporosis. So therefore, the
Oh,
bone density is it's not there anymore. So your bones are not as thick. So therefore, you're at higher risk for developing fractures. Like if you would fall when you were younger, you'd get up, and brush it off and keep
oh,
moving. But at this point, you can fracture and really hurt yourself. So therefore, it's important to kind of look into, or even when you're getting your labs checked, to ask your doctor, hey, how's my calcium level? Is this something that I need to do? Do you suggest a supplement? So, yeah, that's another big area as well. And you may
okay.
have some digestive area issues, which you may feel full, you may feel bloated, and this may be in the premenopausal stage. Like, wow, every time I eat, I can only eat a couple bites, and then I can't eat anymore. I just get full real quick, and it just may be, hey, your metabolism does slow down, but that's an issue that you really want to get checked out, because we don't want to always assume is. We want to kind of make sure that we're under the radar when it comes to working with our doctor. The most important thing that I can suggest and I encourage is to partner with your physician. This is what the doctor is there for. And if I can, we need to change our mindset when it comes to the doctors. The doctors are awesome. They're awesome. And we have to.
We have a caller, hon. Let's take the caller and then I'll let you continue, okay?
Okay, sure.
Hello, caller. I'm sorry, we must have lost them. Okay, I'm sorry. Go ahead, hon.
Okay. So we need to partner with our doctors. Are they back? Or I'm sorry. So it's important to partner with the doctors because they're the ones that can guide us through this. And this is our mindset really needs to change when it comes to our relationship with our physicians. You gotta, and I hate to say this, I am a nurse, so I advocate for my patients and I advocate hard. Okay. So I'm going to advocate for our community. The doctors work for us. We don't work for the doctors. So if there are issues that you have, you need to be comfortable enough to sit down and address these issues with your physician. And if it's a problem, it's tons of physicians out there that may be better suited for you. But the ultimate goal is to maintain your health and wellness. That's the bottom line.
Okay, so our caller is back. We're going to take a call right now. Caller, are you there?
Yes.
Okay. Do you have a question for Nurse Perry?
Yes, I do.
Okay, well, go ahead with your question, hon.
The question is, at 70 years old, should I still be having hot flashes?
You know what? I have heard hot flashes can last. There's no definite time that hot flashes will end. So, and I know it's one of those things. It's just frustrating because you just never know when they're coming. They make you uncomfortable. It's embarrassing. But there is some things that you may want to kind of consider. And I would consider more of the natural ways of remedying the hot flashes versus taking things that probably is going to cause more problems. But yeah, so if you can leave your information with our talk show host, I can reach out to you and we can kind of discuss some things.
Okay, that'll be good.
Okay. So yeah, we'll get your information and we'll definitely reach back out to you. But just quickly, can you just give us some examples of the natural options that are available?
Yeah.
Is it cold wash?
Black cold wash?
Yes.
Yes.
Now, yeah, I heard that.
Don't work.
You said it don't work, caller?
Yeah, and see, that's the other thing. I am so happy you mentioned that because that was the takeaway. So menopause happens for everyone. It's a natural occurrence. It's going to happen for everyone, similar, but it's not the same for everyone. So that particular supplement, the natural supplement, it works for some people, but for some it doesn't. So what I suggest is I am a real big fan of doTERRA. And doTERRA are their essential oils. And what I would use is peppermint. And what you want to do is put just I don't know if you can see it.
Yeah, we could see it.
Okay. So you're going to put just a drop in your hand. And what you're going to do is you can rub it and take it and breathe in. And now peppermint is really strong. So it's going to open up your airway. It's an anti-inflammatory, antibacterial, and an antiviral. So it's helping in other areas too. But what it's going to do is it's going to balance that temperature in your body. And what I would do is also you can use this and you can get your little spray bottle and put distilled water in it. You'll put a couple drops of the peppermint oil. And when you get hot flashes, just spray it over it. It's going to immediately cool you down.
Okay.
Wow.
Okay. Caller, do you have any more questions? Caller? Caller, do you have any more questions?
Yes.
Go ahead with your question, hon.
Where can we find at the health store?
Well, actually, I will leave my information. Like I said, if you can reach out to the talk show host, I can give you that information. I have a website, actually.
Okay. Okay, cool. So yeah, we'll get your information, caller, and we'll put you back in touch with Nurse Perry. Okay.
Exactly. And matter of fact, because it's something that I really stand behind, I want to send you a packet free, and I want you to try it, and I want you to let me know what you think about it.
I will.
Okay,
Thank
caller.
you.
Thank you
Oh,
for
you're
calling.
welcome.
Okay, that was a very good call there. Um, okay, so back to the topic. So we're briefly discussing treatment options. So
Mhm.
what do you think about the unnatural options, the estrogen patches, all of that stuff? What do you think? Do you think those work in a lot of cases, or like you said, sometimes they maybe bring on other problems?
Exactly. So, I know personally there's different forms of estrogen that you place in the vagina. And for those that have a problem with dryness, now I've heard several people say that it really works. And then I have some that say after a while it wasn't the same. So I guess that's just like taking a drug, and the drug works, really well starting out, but then when your body gets
Yeah,
accustomed to it, it doesn't give that same relief. So you just kind of have to mix different things together. But like I said, the most important thing is to continue to talk to your doctor about the options, because they have tons of things out there. And then sometimes these companies will even send you free products to even try if you're kind of hesitant about it. But yeah, I think the estrogen for the vagina works, from what I've heard. And, because sex is very important, it's a natural occurrence as well. And with the men, especially when
girl,
the
you
woman keeps turning
you
them down. I'm sorry.
that you're on those men tonight. That's
Well,
good.
the thing is, because I know menopause, it's something that couples should talk about, but they don't. And it's something that girlfriends should talk about, but they don't. And it's just one of those, it's the elephant in the room that you just kind of slide by and act like nothing's happening. And
Yeah,
maybe sometimes if things are coming from a different person, maybe the guys may open up a little bit more and be like, wow, that's what she's complaining about her. I hear her say that a lot. So the thing about that is, if men can understand taking a piece of sandpaper, your woman or your wife is trying to pleasure you with a piece of sandpaper, okay? How does that feel, trying to stimulate you with that? And that's exactly how it feels when a woman and a man is trying to have intercourse, when this woman is having these menopause symptoms. The vaginal area is dry, so that's exactly how it feels. Sandpaper.
sandpaper. Wow.
Exactly. So then the man is, hey, come over here. He's making advances. Who jumps at that? And
Exactly.
it's not personal. It doesn't have anything to do with them at all. And I want them to understand this. It's not you. It's really women. And we just got to find a way for us to, I guess, find things that's comfortable for us, that will allow us to enjoy some of the pleasures in life that we did when we were younger.
Absolutely. Absolutely. I have another question. So I meant to ask you this when we were talking the hysterectomy. So with once you have the hysterectomy, I know that certain parts are taken out.
Mhm.
Um,
And we can discuss those.
yeah, tell us what exactly goes on when you have a hysterectomy. I know there's several different types. Total, um, can't think of the other name, but I know there's a couple different ways that they can actually do that type of surgery. Tell us some of
Yeah.
the ways that they do the surgery for the hysterectomies.
Okay. So I just want to make sure I'm my little daughter. Okay. So for there's three different types of hysterectomies. You have your standard hysterectomy, and you have the partial hysterectomy, which is also called like a subtotal hysterectomy, and you
Okay.
also have a total hysterectomy. So
Okay.
what happens is, For the standard hysterectomy, you'll have like your uterus and the cervix would be removed. So then that part is out. So with the uh, sub total hysterectomy, which is the partial, they'll cut like a top portion of the uterus off, but you still have most of the uterus there. So
Gotcha.
then with the total hysterectomy, you'll have the removal of everything that's there. You'll have the removal of the cervix, the removal of the uterus, the removal of the fallopian tubes, the removal of those ovaries. They're
Yeah.
gone now. So you're basically gutting that area out. So you have nothing there. So it's the removal of everything. And when that happens, usually you have the fallopian tubes that sit there and they kind of give that structure, but now you have nothing there. So sometimes you may have some prolapse after a hysterectomy, but you don't hear that as often, but it does happen. So
Okay.
depending on the approach that your physician takes, their technique in the hysterectomy, will determine what symptoms you have afterwards. So again, when I say you may be experiencing abdominal cramping, or you just like, oh, these hot flashes is just horrible, and that's something that you need to mention to your doctor. You're thinking something is really, really wrong, or hey, I don't know, this is not working. But then the doctor will say, oh yeah, by the way, I expect you to have that because this is the way I did this. I did this technique, and this is one of the side effects from that. So it's very important to talk to your physician.
Gotcha. 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 Okay, so with I know that women are people the doctors, the physicians, they recommend that women have certain tests and physicals and different annual situations every year. So once that all those organs are removed, are you still required to do like your annual physical, not your annual physical, but your pap smear? Are you still, under that same type of system or same type of protocol once you get those things taken out?
Well, and that's going to depend on two things. One, your physician, and two, what your wishes are. And I just want you guys to know that, you know, you're the driver of the car. So if you feel comfortable going every 2 years or whatnot, after you discuss this with your physician, I feel comfortable if you guys just check me. I just want to make sure everything is okay. Now, the doctor will probably determine if you have to go back for pap smears or your annuals, if they removed your history, if you did if the hysterectomy was removed for certain reasons, like if you have a genetic disposition or you had cancer or any of those things. Now the doctor may want to continue to check you because, as you know, sometimes when we have removed cancer, we can't, I mean, we hoping that, the doctor gets all of the cancer out of the area, but just the fact of the incision, making a cut, can cause, the cancer to kind of move to different areas, and you can't see this. So the best thing for me, I would continue to check up, to just, let the doctor keep an eye on it. Also, you have this HPV now, and that's something that, can cause cancer as well. So, and that's a sexually transmitted disease. So, I mean, as long as you're sexually active, I would feel more comfortable just going in for a pap smear, or just kind of having the doctor take a look at you, just, so you'll know where you stand.
Okay, and what is HPV? What is that?
Actually, it's a human papilla virus, and it is more, I think it was like maybe 10, 13 years ago, it came out on the scene, where it's something that is transmitted with sexual contact, and it can produce or cause cancer. It has the cancer cells in it. It can cause dysplasia, which means it's like a buildup or a production of abnormal cells and tissues in the vaginal area.
Yes.
And if it stays there long enough, and it just gonna, and cancer cells reproduce quickly sometimes.
Mhm.
So therefore, if you're not keeping an eye on that, and you think, hey, I have nothing down there, I'm okay, and then you have something else going on. So HPV, it is transferred sexually, and it is known that, if it depends on the different type of HPV, it can cause cancer. Some HPVs may show just the abnormal cell formation, which
Mhm.
means the doctor will just basically keep an eye on it. But you'll have to have a biopsy just to make sure that those cells are not they're benign, they're not malignant.
Gotcha. Gotcha. Okay, I know that I thought it was the HPV that had uh um like a vaccination for.
They
Is
do.
that
Yep,
okay?
you're absolutely right. And
Okay.
yeah, over the years that has come out, and it basically prevents HPV, and they are actually administering this vaccine early, like early teens, 11, 12, so it's more of a preventative, so yeah.
Okay. Well, that's good. That's good. I actually my daughter, I got my daughter that vaccination. Her pediatrician recommended it
Uh-huh. Yeah.
when, like
Yep.
you said, she was like 12 or 13 or something like
Hmm.
that. So yeah, I'm
Hmm.
familiar with that one. I'm just going to do another quick station ID. You are watching In the Know Live, streaming on Facebook, YouTube, Twitter, Twitch, and other top social media networks. Please like, follow, and subscribe. Thank you for watching WJZZ Cool TV, the coolest station in the world. Today we are here with Nurse Keisha Perry. She has given us some phenomenal information today on women's health and menopause. If you have any questions for her, please chime in. Call us at the station number 313-355-6018. I am just going to discuss, or I want your opinion on some of the misconceptions involving women's health.
Hmm.
Um, so, with menopause, with hysterectomies, and all that good stuff, low sex drive after menopause, or no sex drive after hysterectomy. Is that something that hear to be common, or?
Yeah, it I hear it a lot, but as you like I've stated, and I will continue to basically, this is my disclaimer, that
Uh-huh.
menopause is individualized, but we all experience it, but we experience it differently. So I
Okay.
have heard a lot of women would basically complain that the sex drive after menopause has increased. Their I mean, the talk was orgasms. So their orgasms become stronger after menopause. But then I've also heard on the flip side of that the sex drive is lower. And we got to go back through the anatomy physiology. When you remove those ovaries that has that hormone, hormone, the estrogen in it, it decreases. So when you don't have that estrogen, your everything decreases. The sex drive decreases. So you don't crave that sexual experience. And then if you have decreased estrogen levels, of course, that vaginal area is going to be dry. It's not going to be lubricated, and of course, that's not something that you desire. So, like I said, the lubrications and things like that, the KY jelly, they have several different ones here that you can kind of try. But I mean, I've heard both. The sex drive decreases, and it's for many other reasons. It's for the physical reasons more so, but it's not to say that after menopause you no longer want to have sex. That's not the case. It's just that you have to kind of work with your body and your partner as well.
Gotcha, gotcha. I don't think we've really touched on the mental health aspect of menopause. Can you kind of, touch on that? Some of the things that a person should expect mentally, during the stages of menopause.
Yes. So, when the estrogen levels decrease, your energy level decreases, and therefore you're not as riled up. You don't have that rambunctiousness, and of course, you can get a little bit, I would say, depressed, because at this point you understand that things are changing. Even though you may not verbalize it, you know within your body that things are changing. So therefore, along with menopause, um, we see these correlate. They can be they can kind of ride on the same path. But what we don't want to do is we don't want to say, hey, you're depressed, and that's the issue. You're just depressed, because a lot of times menopause mimic depression. So don't want to be, you want to be diagnosed accurately, so then you can get the treatment that you need. So with depression, yeah, because you got to understand, your menopause is like your final, it's final, your fertility is gone. And being a woman, that's part of who you are as a woman.
Mhm.
So, a lot of people don't touch on that aspect of it. You feel a loss, you grieve, and then you start thinking of, your life and how it looks like now and how you feel. So therefore, yeah, mental health is a big part of menopause. But again, if you never discuss it, you never talk to your physician about it, you never talk to family members. And I'm one to ask questions. I've always asked questions. And what kind of triggered me is I heard a lot of coworkers, friends talk about menopause. Oh, these hot flashes. Whew, you just don't understand. And I was only 25 years old. And I was like, what is the hot flash? And then this one woman, she was trying to master these symptoms. So I would report back every day. So what did you do? What happened? And so what she told me is, I noticed the diet intake, the type of foods that I eat, has a lot to do with the hot flashes. Chocolate, caffeine, all of that triggers coffee, all of that tea with caffeine, it triggers the hot flashes. So she says she cut back on the foods that she like, and which includes any kind of caffeine or the chocolate. And then she also exercise really helped her, because her husband would complain that she's sleeping at night and she would have to either have the fan on or the window open. So
Mhm.
therefore, the husband didn't want to sleep in the room. He had a separate room. So, it's causing more problems, and that's why I talk to the men, to try to understand this. But at the same time, she kind of got everything under control. She exercised where she would sweat, and that would actually kind of balance her hormones at the time. So, I mean, I would see her, she would carry a little fan around. She's constantly, but at the
Yeah.
time, I didn't know about, doTERRA and peppermint oil and everything like that. So I've learned and I've watched for years. So yeah, it's a lot of things that you can do, but yeah. So
Okay. Cool. Cool. Okay. So, I was just going to ask, what are some of the things that can kind of ease some of those side effects? But you just kind of went into the exercise and,
mhm.
some of those. I've even seen things like cool sheets. They sell like cool sheets to assist
Oh
with
wow. Oh
hot.
wow.
Yeah.
Well, and I didn't hear about the cool sheets, but that's a good idea. I mean, and
Sheets.
then maybe even ice packs. They have the disposable ice packs. Maybe just popping one of those and putting it on the back of your neck or your forehead, just to
Mhm.
kind of, get you to cool down. Also, your diet. You want to eat lots of vegetables. You want to eat the fruit. You want to eat healthy meats. Decrease fats. It's really important. Protein is very important. But yeah, so yeah, exercise, diet, lots of water. Lots of water, because you want to flush out all of those toxins in your body, and you want to make sure that you're hydrated. You want to help lubricate your joints in all of the areas where the estrogen was lubricating everything, and now you have decreased amount of estrogen, so you need some help there. And water is your best friend. It's going to keep those joints lubricated. I suggest every day, if you can keep a bottle of water by your bed when you first wake up, before you even get out of the bed, open it up and drink it. It's called joint juice, is what I call it. It's the natural joint juice.
Okay, that is good. That is such good advice. Um, I know that during the COVID, there has been a lot of push for telemedicine.
Mhm.
Some people are fans of the telemedicine, some people are not. What's your opinion on the telemedicine as it relates to a person's overall health? Do you think a person can maintain their health through a telemedicine type service?
Well, I think telemedicine is excellent for the purpose that it was designed, in emergencies, or if you can't get in for whatever reason you have going on. Who knows, maybe you have COVID. And I mean, you don't want to just like push these individuals to the side just because they have COVID. It's good because these professionals, these healthcare providers, they're able to lay eyes on you. They're able to listen to your complaints. What are you experiencing? Otherwise, I mean, you just kind of lay around at the house and nobody knows what's going on with you. So if this is your only means of contact with a healthcare provider, I think it's excellent. But I feel if you can go in and they can actually see you, it's even better. I can kind of think of a time where, if I hadn't have went into my physician, they would, I mean, he wouldn't have known. It's just because I know me, and looking at my neck, it's like, oh, my neck is kind of, I pushed on it and it made me feel dizzy. I'm like, what is going on? So then I allowed my doctor to finish his assessment. I was like, well, doctor, did you notice that I have this lump on my neck? And he was like, no. And then he looked at it again. He's like, oh, yeah, you do. When he pushed on it, I got dizzy again. So at that point, we started out with, going to get an ultrasound of my neck, which was the thyroid. And then we kind of followed up after that. But the thing about it is, he wouldn't be able to palpate and touch and
Yeah,
feel, oh, yeah, that is different. It is a knot there. So I'm a firm believer, even at the bedside when I practice. I know that it probably drives the doctors crazy. But the thing about it is, I can explain to you all day what I see. But that doesn't make you see what I see. So if you can come down and take a look, and we both look together and we have a baseline, we're on the same page. So,
mhm,
sometimes you just can't explain things or say, hey, this person being in the office is like, they look terrible. Are you okay?
yeah,
And you can't really see that, doing the telemedicine, other than if they tell you. And some patients are stoic. Oh, no, I'm fine. I'm
yeah,
fine. So, and that's not always the case. So I do like telemedicine. I think the design was, it's very purposeful.
yeah.
But if you can incorporate it with actual visits, then I think it's wonderful.
Okay, okay. So with um where was I going to go with that? With the telemedicine, and you said earlier that a person was the driver for their own health. What would you
Mhm.
recommend, like on a regular basis, for on a annual basis, for a woman to question their doctor about, or test that a woman should have on an annual basis? So we probably
Well, first,
labs. What should a woman have on an annual basis? Say, for example, a woman in perimenopause, or pre or menopause. What
okay.
testings and exams should she have at that point?
So first of all, I would suggest that partnering with the physician is important, but at the same time, they're really busy. So you got to make use of the time that you have with them. I would suggest getting a notebook and writing down different things that you may experience. Like, today I had a real sharp pain in my hip, and it made me bend over and I couldn't move for like maybe 5 minutes. And I noticed this happened 2 months ago.
Mhm.
or it's starting to happen more frequently. And these are things that you tend to forget when you go in and see the doctor, because if it's not paining you at that time or causing an issue, you're not going to remember it. So therefore, this allows you to see where you are in your health status. So with that list, then you can say, hey, the doctor say, well, maybe if you're having that pain as often as you have, I see you've had it like 3 times now, maybe we need to get an x-ray, and you're really tired and you feel like you're not yourself and you're sluggish and all you do is sleep. And I've known you to be a very active person. You can't sit down. You're always doing different things and energetic. And now all of a sudden there's a change. Let's look at your complete blood count. We want to look and see what your iron levels are. We also want to look at maybe your vitamin D level. A lot of times the sun actually triggers the production of the vitamin D in our body. So we need sunlight. We need to be out in the sun. Whenever the sun is out, if you can go and sit out 10 minutes or walk, it's important. It activates the vitamin D. Vitamin D helps with depression. So, when we don't get these things, our body tries to, tell us what it needs, but not always do we listen. So with that list, I would suggest to point out the things that you're experiencing, because if it was up to me, it's like, yeah, go in every time something is good. If you cough, go into the doctor. But I won't say that, because health insurance, they are the gatekeepers. And
Yeah.
therefore, if you go in too many times or have too many labs drawn within a certain period of time, they're not going to pay for it. You'll end up paying for it out of your pocket, or they'll deny it. So with that, you want to make sure that your visits and your tests are purposeful. They're on purpose. This is what we're looking for. Okay, we can cross that off the list. I checked that. And that notebook, believe it or not, you go to the doctor so often you can't remember, oh, what did they say? I can't remember. Your notebook will guide you. You'll be able to go back and say, oh yeah, I need a follow-up. It's time for me to make an appointment for this. So it's important for us to advocate for ourselves and partner, like I say, with the doctors, because the doctors have so many patients. It's impossible. So therefore we have to take the initiative to keep ourselves healthy and to make sure that we're in a state of wellness, to where we'll have that quality of life that, we can enjoy our lives, we can enjoy our families, we can do the things that we like to do.
Absolutely. Well, we are nearing the end of the show. I want to thank you for coming on. As I told you guys, Keisha Perry is going to be here again with me next week. We're going to be discussing more women's health issues. Keisha, do you have anything you want to say? Well, we got a couple minutes left. Do you have anything you like to say?
Um, Actually, I have tons of things to say, but nothing that I haven't said already, other than, I am very privileged to be here to share with the community. I am passionate about the health of women, and the wellness, and anything that I can do to help a woman, even if it's advocating. Hey, I don't know exactly what questions to ask the doctor. And, when you don't come across as confident, then a lot of times you're kind of, all right, you get a little bit flustered. You like, oh, forget it. And we don't want that. Everybody should be heard, is how I feel. If you have an issue, then we want to know about it. So, and I'm an advocator. I will advocate for you. So what are the other options? What else can we do besides this? So, and those are the things that we need to get comfortable asking our doctors. It's not that we're trying to be that patient. It's
Mhm.
just that this is my life, and you only get one, just one.
Absolutely. Absolutely. And with
And
that,
don't need to apologize for it. It's just, hey, I'm not trying to be rude, but I am concerned. This is some of the things that I thought maybe we can look into.
absolutely. And with that being said, I want to thank everybody for joining us. I want to thank the caller for calling in. We will see you guys next week on In the Know on WJZZ Cool TV at 6 p.m. Thanks, everybody. Thanks, Keisha. I will see you
You're
next
welcome.
week.
See
Take
ya.
care.